So Friday of this past week was probably the low point of my experience taking care of our patients during the COVID-19 epidemic. That morning I was working out of the Hub of Hope, which is a health clinic for unsheltered citizens of Philadelphia, where we offer shower, laundry, medical care, and social services. What I remember about that day was the fact that I had to test a patient for COVID-19 and then had to discharge him to the street because we had no options in terms of providing shelter for an individual who we presumed was positive, but had no place for him to go. And this awful decision came out of really hours of advocation on his behalf with the city of Philadelphia, who was unable to provide shelter for him, or trying to cajole hotels to open their doors to allow this individual to have medical quarantine for a 5-day period while we were waiting for his test result. I left that day feeling like I had failed in terms of my oath as a physician. Our shelter systems are ill-equipped really to meet the CDC requirements for appropriate physical distancing, and hospital beds are a precious commodity reserved for those who are ill. So people who are exhibiting mild cases, would typically be told to stay at home and symptom monitor, it's not an option for people who are unsheltered. People have asked what we can do, or if I have any recommendation. So, my recommendation is ask what your municipality, your city is doing to make sure that our homeless citizens are being cared for. And if there isn't a plan, be willing to advocate for them. The media is one of those outlets that we're finding has power during this time to help to promote change.